Keeping an eye out on our heart health is so much important, especially if you want to find things early before they get very serious. Your heart is like an engine that pumps the blood, it pumps the energy through your body. ECG can help you diagnose a lot of common conditions. Earlier in the days, we had to go to a doctor's office to get this done, but you can get a basic version of it done using a wearable device these days. Many of these devices can also estimate the oxygen levels in your blood or give you a sleep score based on how well you slept or give you an energy score depending on how well you're doing in general. These wearable devices can give you an early warning sign for a lot of health conditions, especially hypertension or high blood pressure.
In today's fast-paced world, it seems like the heart health is becoming an increasingly urgent concern. We say that it's because of the daily stresses of our life and the changing landscapes of our diet. Because of all these factors, cardiovascular issues are on the rise. For decades, ECG and blood pressure monitoring have been the gold standard for detecting and tracking heart-related conditions. And that's where the revolution of wearable devices comes in. Smartwatches and other wearable technologies are now increasingly capable of providing accurate ECG and blood pressure readings, further empowering us to take control of our heart health like never before. Welcome to Health Watch, where we delve into the world of cardiovascular health. And joining us today is a very special guest. He is joining us from the United States of America. We have with us Dr. Gaurang Vaidya, who's a leading cardiologist, and he will be discussing crucial aspects of heart health monitoring, especially ECGs and blood pressure. And amid all of this, the role of wearable devices in monitoring these crucial parameters. Dr. Vaidya, thank you for being here.
Thank you so much for having me, Risha.
Dr. Vaidya, let's jump right in. For our listeners who might not be familiar, can you briefly explain the importance of monitoring heart health and also the key indicators that we should be paying attention to?
Absolutely. Keeping an eye out on our heart health is so much important, especially if you want to find things early before they get very serious. Your heart is like an engine that pumps the blood, that pumps the energy through your body. The key parameters that you can look out for are heart rate, blood pressure, heart rate variability, cholesterol level, ECG. These kind of give you a snapshot of how healthy your heart is. This is especially true for us Indians because research has shown that we are prone to heart disease pretty early in our life. But in our busy life, we rarely have time to pay attention to it.
Dr. Vaidya, one of the cornerstones of heart health monitoring is the ECG, also known as electrocardiogram. Could you explain what an ECG measures and why is it so important?
Yes, sure. ECG records the electrical activity in the heart. As somebody's heart pumps, there is a tiny electrical spark that goes through the heart. And the ECG records this tiny electrical spark and puts it on a paper for everyone to read. This is important, so it tells us if your heart is beating in a steady rhythm or if there is an extra beat that comes in every now and then, or your heart rate in general is just slow. It also tells us if your heart has been hurt in the past, such as having had a heart attack. Earlier in the days, we had to go to a doctor's office to get this done, but you can get a basic version of it done using a wearable device these days. So ECG, when it comes to ECGs, these wearable devices use certain kind of light sensors and a clever math to estimate what your heart rate and rhythm is. Sometimes all you have to do is touch a sensor and it gives you a basic version of that ECG right in front of you at a leisure of your home.
Dr. Vaidya, I just want to take that point forward. What are some common heart conditions that an ECG can help us detect? And I'm also wearing a wearable device in my hand. How can wearable devices help us in detecting the same?
ECG can help you diagnose a lot of common conditions. So one of the common conditions it can help diagnose is called atrial fibrillation or AFib. In this, somebody's heart can be going fast and irregular. If you are wearing a wearable device, it can send you an irregular heart rhythm notification. In this atrial fibrillation, the upper chambers of the heart or the atria are not really squeezing, they are fibrillating, and that can stagnate the blood in the upper chambers, and that can cause a clot, and the clot could travel and give rise to a stroke. The other condition is bradycardia, in which somebody's heart rate is just going slow, and that can give rise to tiredness or sleepiness. One of the first tests that is done when somebody comes to the hospital with chest pain is an ECG, because it can help diagnose heart attack based on the way the electrical activity is happening in the heart. Then it can help detect if somebody's heart is thicker than normal or if there are electrolyte abnormalities in the blood that can interfere with the function of the heart.
Dr. Vedya, blood pressure is another critical measurement. Could you perhaps elaborate on the significance of maintaining healthy blood pressure levels and also the risks associated with hypertension?
Yes, absolutely. So, blood pressure is really the force that the blood exerts on the arterial wall. So, if somebody's blood pressure runs high, or hypertension as it is called, then it is up to the heart to generate that kind of force to get the blood out into this high pressure system. Think about increasing the workload on the heart. So it is that much more important for you to keep the blood pressure in the healthy range, because over longer term, that can give rise to issues such as heart failure, stroke, kidney issues. I have seen people, have serious trouble because of this hypertension, because it is a very sneaky condition. People many times don't have any symptoms when their blood pressure is running high.
Right, absolutely, Dr. Vedya. I just want to take that point forward. How perhaps can we monitor BP using wearable devices like the one that I'm wearing right now?
Yes, so wearable devices continue to evolve every day, and they will continue to evolve in the future too. When it comes to ECG, the wearable devices use certain kind of light sensors or a clever math to estimate your heart rate and rhythm. They can send you an irregular heart rhythm notification if they realize that something is wrong, something is not right. Many a times, all you have to do is touch a sensor, and it gives you a basic version of the ECG right in front of you at home. So this is kind of a proven technology in many ways. But on the other hand, the blood pressure monitoring, it is a novel and exciting technology. It can give you a trend of your blood pressure right at home. Especially if your blood pressure has been creeping up, it gives you a notification. Remember that these devices are great at giving you a trend of these recordings. But again, if you need to get a full picture, make sure you correlate these findings with the doctor's office.
Right, Dr. Vedya, you've clearly listed out the features of a wearable device. Apart from ECG and blood pressure, what are the other features of these wearable devices, especially for someone who wants to buy a wearable device for heart health monitoring?
That is a great question, Raisha. So if somebody is looking to buy a wearable device, there are a lot of cool features that you can look for in the health segment. Look for a device that can monitor your heart rate, give you a heart rhythm notification if something's irregular, give you a basic ECG, or even measure your blood pressure. Many of these devices can also estimate the oxygen levels in your blood, or give you a sleep score based on how well you slept, or give you an energy score depending on how well you're doing in general. This all ties into your heart health in general. A device that comes from a reliable brand is sometimes a sure bet for reliability. If these devices, if they show a dip in your heart rate or a jump in your blood pressure, that is a notification for you to be wary of these things. Some of these devices can have artificial intelligence, where as you wear these devices, it's constantly learning what is right, what is the usual pattern for you. And if it detects that something is not right, then it kind of sends you a notification. So you can incorporate any or all of these things to, into your daily routine.
Right. I also want to ask you about if there are any specific demographics or individuals who would benefit most from using wearable heart health monitors.
Yeah, that's a good question, Raisha. Wearable devices can be a game changer for so many different people. This is especially true for us Indians, as I mentioned earlier, where we are prone to heart disease early in our life because of our genetics or central obesity. In addition to that, if you have a family history of heart disease or you suffer from hypertension or diabetes, then that is so much more important for you to stay on top of your health. Even if you are an individual who is very active, goes to the gym regularly, these devices can help you make sure that the heart is handling your workout very well. I've seen these devices used by younger people to track their steps, to track their heart rhythm, just to make sure that they can solidify their habits of sleeping and staying active. And I've seen these being used by older folks just for the peace of mind of constant monitoring. Really, these devices are meant for anybody or everybody who wants to stay in tune with their heart health.
Right, Dr. Where they've listed down the positive aspects of all these wearable devices. I want to ask you more about your assessment as to how do you see the role of these wearable devices evolving in the future?
The technology of wearable devices is so exciting and it keeps on evolving. It's going to be a game changer for a lot of people. We already use wearable devices for heart rate monitoring, rhythm monitoring, but they can do so much more in the future. They could send your health data to your doctor, allowing them to check up on you while you're several miles away. Or they could send a notification to the doctor while something bad is happening, like a heart attack. Imagine not having to go to your doctor's office that often just because your health data was already sent to them and they have already sent you a notification back. The artificial intelligence could evolve to a point where it is able to guess what could happen in the future depending on what pattern it is already seeing in you. They could help detect things super early, saving lives already. They could remind you to take certain medications, or they can help you tweak the timing of the medications based on the pattern of heart rate or rhythm that they're seeing. It is so much thrilling for me to think about how these little gadgets can make the heart health personal and reachable for so many different people, no matter where they are.
While we are seeing this advent of wearable devices, what are some common misconceptions that people have, especially about heart health monitoring when it concerns ECGs and wearable devices?
That is a great question, Raisha. There are some misconceptions surrounding the wearable devices. I think the more common misconception is that heart health monitoring is only meant for older people or sick people. This is not true. As I mentioned earlier, really heart health or heart diseases can creep up on anybody, young or old. So anybody who wants to stay in tune with their heart health can benefit from these devices. One other misconception or common misconception people have is that these devices can be a full replacement for your doctor's advice. That is not true. These devices are great at giving you heads up about the trend of your heart rate or your rhythm or your blood pressure, but they are not a full replacement for your doctor's advice. If there is something that comes up or a notification that comes up on these devices, it is your cardiologist, it is your doctor who will make the final diagnosis. So it is very important to know this fact. These tools are handy, they can be used as a helper, but they are not a boss. They are not going to make the decision for you. Pair these devices with regular health checkups to make sure that you get the right diagnosis at the right time.
Right, Dr. Vedya, beyond monitoring, what lifestyle changes do you recommend for maintaining optimal heart health, or, like they say, to maintain a good heart?
Yes, absolutely. So keeping your heart healthy, it's all about making those simple and easy choices like eating fruits, veggies, whole grain, staying away from salty or fatty food. Moving your body is such an important thing. Incorporating some sort of a nice little walk or yoga can go a long way. These wearable devices can, help you track your sleep, can give you an energy score based on how well you slept or how well your activity has been. That can play a big role. It's all about feeling refreshed the next day. Stress is a big issue. It can mess up your heart. So coming up with relaxation techniques, yoga, breathing exercises can go a long way. If you're a smoker, quitting smoking can be a big win for your heart. Also, laying off on alcohol can go a long way.
Right, Dr. Vedya, lately there have been many cases in the news highlighting sudden health scares that's due to high blood pressure, often called the silent killers. And we say that because many people don't realize the danger until it's too late. In such a scenario, how effective are wearable devices in detecting early warning signs? And what proactive steps can people take to manage their health better?
This is a very important question that you just asked, Raisha. These wearable devices can give you an early warning sign for a lot of health conditions, especially hypertension or high blood pressure. These wearable devices, they can help, these handy little gadgets, they can track your heart rate, your blood pressure, give you a basic ECG, or send you this irregular heart rhythm notification. And they can help you diagnose this sneaky little disease that is called hypertension, because many patients don't have the symptoms when their blood pressure runs high. It's only much further in the future, has already done all the damage, that you start having the symptoms. But again, it's very important that these devices are not a full replacement. They can be great at doing early notification of a blood pressure that is creeping up. But again, if you want to get a full picture, make sure you talk to your doctor who can paint a full picture for you.
Dr. Vedya, before we finish this podcast, I'm just curious. I want to know the role of wearable devices in your day-to-day life.
Like for me, these devices have been extremely helpful. I've been using them for quite a while now. I use these on a daily basis when I go to the gym. I use these to track my steps. And something that I especially aim to do is get to the 10,000 steps on a daily basis to make sure that I feel like I achieved something great for the day. So when I think about my own personal experience, I remember this one particular patient who was wearing a wearable device and realized that they were having AFib all this time after they started wearing it. They brought it to my attention, and I realized that this particular patient was having atrial fibrillation. Being able to diagnose it and being able to put them on blood thinners allowed them to never be facing a risk of having a stroke in their life.
Dr. Vedya, thank you so much for being here with us today and sharing your experience and anecdotes with our listeners. Before we wrap this up, any final thoughts?
Thank you so much for having me today, Raisha. It was fantastic talk about something that is very close to my heart. As a final parting thought, what I would say is that you are in control of your heart health. With these handy little gadgets, you can really take control and have the power to be able to direct how your heart continues to be healthy. In addition to that, you can pair these devices with eating healthy, staying strong, and staying motivated and sleeping well. It's all about making those healthy choices and being proactive and being curious about your health. If something doesn't feel right, don't hesitate to talk to your doctor to get a full picture. Here is to happy and healthy hearts.
So that was Dr. Vedya providing us insights into monitoring your heart health. Stay informed, stay safe, and remember that your heart health is in your hands. Well, with that, we come towards the end of this podcast. We'll catch you in our next podcast.